welcome to the Squawk Sesh. Today I have Heather Simons, and she's going to answer some questions for us. So thank you so much for being here.
You're welcome, Cameron. Thanks for the invitation.
We're always glad to have you. And we've been getting so many questions, and we're like, we need to have Heather on here. So we sent out some questions to students, faculty, staff, and we did get some back, and we're just going to ask you some of those today. So let's get started.
Sure.
Okay. So our first one is can you share a little bit about your background and how you became a campus counselor?
So I have a master's degree in counseling, and I have been a counselor for 28 years now. And my heart is in trauma work. I recently started my own private practice in Eden. And as part of that, I contract with the school to be able to provide the services for the students.
Okay. So what inspired you to pursue a career in counseling, particularly in an educational setting?
So when I was little, I was asking my mom what she thought I would be good at. And she had said social worker. And I actually got my bachelor's degree in social work. And when I started working in that field, I realized that that's where you refer people to different services. I wanted to be the person that they referred people to. So I got my master's degree at that point in time in counseling. And I love working in community mental health. And when the position came open to be part of the college campus experience, I asked to be part of that, to be the clinician on campus.
And I can, when you're saying all this, I can see the passion and the care that you have for your students, being a part of, a daily, being more.
I do. I love it. It's awesome. It's a good population.
So another student asked, what does a typical day or week look like for you as a campus counselor?
As the campus counselor, it varies on where it's at in the semester. The end of the semester and the beginning of the semester are really kind of slow. And in the middle of the semester, I'm usually pretty slammed. And so early on, I'm not doing a whole lot. But come the 5th or 6th week into campus, into the session of the semester, I can have 3 to 4 sessions a day. I usually try to cap it at 3 because any more than that's pretty exhausting.
Right. Okay. So another student asked, could you explain the primary responsibilities and roles you fulfill in supporting students on campus?
So as the mental health counselor, I accept walk-ins so that if somebody's particularly stressed, they can come and stop by. That's not always available because if I'm in session, obviously the door's closed.
Right.
But I also provide scheduled and virtual sessions to be able to meet with me online. My specialty is mental health. There are some limitations that I do. I don't do intensive trauma work here on campus just because that's not really the purpose that I have here. And so trauma work, substance use, and things like that, I generally refer to the community resources that are available, medication management, things like that. So I'm also a referral source to be able to link students with other services. And then I provide counseling for depression, anxiety, relationship issues, all of those kind of things.
Okay. So what are some of the most common issues or concerns that students approach you with?
Stress management is a big one. Our students are frequently double and triple rolled. They're a full-time parent, they're working full-time, and they're a full-time student. That's a lot. That's a lot for anybody. And so a lot of times students are come to me for either time management or stress management. That's probably the most common. One of the other things that I have some students that know they have a mental health diagnosis that meet with me just to know that I'm here and to be familiar with my supports, and then they come and see me as needed. So these are people who have had services in the past with another provider in the community, have graduated from their services, and then just want somebody to touch base with as needed.
Okay. How do you typically address academic, personal, or social challenges that students face?
Well, a lot of that's really specific to each student. One of the things a lot of people need is just to be listened to. They just want somebody to take the time and listen to what they're trying to say. Somebody that's not judgmental, somebody that's not already in the mix. And sometimes just that provides clarity to the situation. Other times, it may be some basic advice about pointing out some small things that they might be able to adjust differently. But a big piece of it is listening.
That is a good approach. What resources and support services are available to students on campus, and how can they access them?
As far as mental health, I'm pretty much it on campus. I do refer primarily to Daymark for like substance abuse treatment and for medication management. And the reason I refer to them is because they don't require health insurance, and some of our students don't have health insurance. They also accept Medicaid.
Okay.
So I definitely refer to them for some of the things, and they're just around the corner. They're a stone's throw from campus. As far as other services and things like that, I can help people get involved with vocational rehabilitation. I can help them get connected with a counselor who's in the community. So if they need to do some trauma work or something like that, I can help with that as well.
Okay. Are there any lesser known resources that students might not be aware of but should totally take advantage of?
Check with financial aid, because a lot of times there are services like even for childcare and things like that students are not availing themselves of, and like the food pantry and things like that. There are services on campus, even counseling, that students aren't really aware of, that if they just ask, there's a lot of times services that could help. We can't help if nobody asks. We
Right.
need somebody to reach out and say, hey, can you help with this? And a lot of times, even if I can't help, I can find somebody who can.
Okay. So how does the Counseling Center contribute to mental health and the wellness of students?
So I do some educational things like this. I've speak in the classroom sometimes, and then I contribute hopefully to the mental health of students by helping them cope and learn coping skills and be able to be functioning at a better rate than they were before they saw me.
Well, you definitely contribute. You are a big asset on our campus, and it's so grateful to talk about how we can discuss mental health and how we can address, some things, bring it to light so students can feel more comfortable and just know.
When I first started here, I couldn't believe how many faculty said to me, we are so glad you're here. I heard that over and over and over again. And it's kind of unusual, I think, for a community college this small to have a mental health person on campus. A lot of times they contract out, or they don't have somebody who's on campus, they have virtual or whatever. And so it is unique. And I hope that students will take advantage of that, and that faculty and staff will make the referrals for folks to come over.
Yes, and we definitely do. Someone will come and ask me, I heard you guys have a counselor here, and we're always quick to go, she's that way and she's great. And if the door's closed, there's some business cards on the door.
Yep,
so you can
absolutely.
just always reach out, always contact. And I think how accessible it is very helpful to us, and it's great. What approach or technique do you typically use in counseling sessions?
So particularly on campus, I use cognitive behavioral therapy.
Okay.
So we spend a lot of time looking at what the behaviors are that need adjusted, and sometimes just coming up with some realistic goals to adjust those. Also looking at the cognitive distortions, which is screwed up thinking, and being able to address those and change the thinking. Particularly with anxiety, I always say anxiety is a thinking game, that when you're able to adjust your thinking about something, a lot of times the symptoms of anxiety will diminish on their own.
Okay. How do you ensure a safe and confidential environment for students seeking counseling services?
That's a really good question. I use a sound buster outside my office to help prevent anybody from being able to eavesdrop, even somebody who's just walking by.
Right.
So that assists with that. I am kind of off the beaten path to some extent, so it's not that students will be observed directly walking in. Also we have the option of Doxy, which is a virtual appointment online that we can use, so they can actually, get online and be seen from home, which is completely confidential, and it is a HIPAA compliant service.
So you're saying that if they can't come on campus, we have accommodations to where they can have counseling at home?
Absolutely. Either that, or if they're concerned about anonymity and they don't want to be seen walking in, they can schedule that way as well.
That is good.
Mm-hmm.
I'm learning something new here.
Good.
How does the counseling center handle crisis situations or emergency involving the students?
We haven't had a whole lot, which I'm thankful for. I have been consulted on a few. A lot of times I'm not involved directly, but I'm more coaching the faculty and staff that are. Mm-hmm. We haven't had a whole lot. It's more dealing with stuff after the fact. Mm-hmm. I have been used as a resource for folks who are required to see me in order to be a part on campus and be able to continue in classes. They have done that for me. I am able to de-escalate so that if that were needed, but at this point in time, I think they usually leave that to security.
Right. Good. So, another student asked, what resources are in place for students experience immediate mental health concerns?
So if I'm available, of course, they're always able to come and talk to me. I know that I'm not always available, whether I'm in session or I'm not on campus. If they are needing direct assistance, you can always call 911 and ask for mental health. That is the easiest way to access it. There are mobile crisis lines that are available through the community, and there are 800 numbers that are also available. That's the best way to be able to access if you need immediate assistance.
Right. Okay, so I have a few more questions about stigma and awareness. How does the campus community address the stigma surrounding mental health?
So I've really tried to make it very open for students to recognize that it's not a shame to get treatment for mental health. We have to be culturally sensitive with that because there are a lot of cultures that there is a big stigma associated with that. And trying to break that down can be difficult. One of the ways that we do that is by confidentiality, that I'm not contacting parents, I'm not contacting friends, so if they need that to be secure, that's an option. But I also try to educate and let people know that a lot of times mental health problems are just part of life. It's part of what we go through. Even just going through a difficult time can lead to and trigger a mental health incident, I guess we could say. Whether it's a breakup or whether it's losing a job or whatever that happens to be, sometimes that can trigger some mental health problems. And they might just need support. A lot of students come in for 1-2 sessions and they're fine. They just need support through something minor that's going through their life. And I don't want it to seem like, we have to go to mental health counseling and you see a psychiatrist and get a label. I don't even do a full diagnostic evaluation on the majority of students, so they don't even walk away with a diagnosis.
Would you say, I've heard some students will say, I have to go to a counselor, and, I'm so nervous, kind of like how you're saying the stigma. Would you say that everybody at some point in their life might need counseling or, should at some point go? Because that's something I've heard before. And just getting the advice from somebody who knows. Well, what would you say?
I think that it depends on their natural support system.
Okay.
If they have a good, healthy, unbiased, supportive, natural support system, a lot of people don't need counseling.
Okay.
They may have church members or family members or friends or significant others that are able to provide that support through the storms of life. But when somebody does not have that available to them, when they're struggling to be able to deal with things on their own, or their supports are unsupportive or biased, then a lot of times just having somebody else be a part of that conversation can really make a difference.
What is a way you think that somebody could go around and find a good support system, whether it's joining a group or somewhere they could go or people they could talk to? What is a good way for people to have a better support system, I guess?
That's a really great question. And being Rockingham County, we're a little impoverished on some of those things. So a lot of what is obtained online. If in Greensboro area, there's a support group for almost anything, but a lot out here, there's just not the availability that we have in bigger cities. So being able to volunteer or being parts of groups on campus or being part of a religious circle are options to be able to expand that natural support system. It's difficult though, and it's really challenging. And one of the things a lot of people face is when their natural support system is toxic, a lot of times they will even restrict access to healthy supports. Becomes very hard.
Thank you.
Sure.
So as a counselor, how do you personally practice self-care, and what advice do you have for students regarding self-care?
Self-care is really important. I do some supervision for what I call baby counselors, new counselors that have just graduated, and I preach self-care over and over and over again, because if you don't master self-care, you burn out, particularly in my field, very, very quickly. Personally, you won't see me in my office without having knitting or quilting or a book or watching even videos that I enjoy. I also exercise. I'm active in my faith. There's a lot of different things that I utilize to be able to sustain, because especially as a trauma counselor, it's difficult.
Right.
And I think that it's very important that we always set aside time for ourselves, which is difficult if you're working a full-time job and going to school and have kids. So one of the things that I talk to students about is practice being mindful of just the small things in life that we enjoy, like taking a shower, using good smelling shampoo, taking time in the shower to pay attention and be mindful rather than pre-working. A lot of times we get in the shower and we're already thinking about all of the things and complications that we have for the day. That diminishes from even those small things that we do for self-care.
So what is something you would say to somebody who is not in the habit of self-care? They have a hard time with that mindset, and some feel like they don't have the time, they might not even deserve to. What would you tell them to encourage them to have self-care, build that into their life? And
well, one of the things I used to use, particularly with moms, is I would give them a box of crayons. And then I would list different things that they had to do through the day, like, taking your kids to appointments, doing homework with them, cooking meals, all of those things. And then eventually they have an empty box because I have all the crayons. But then we do the same routine where they have the box of crayons and I take things, but then for every self-care that they do, they get crayons back.
Oh.
So you see that you have so much more that you can give to others just by taking a little bit of time for self-care. It sustains you rather than being selfish. In fact, just the opposite. Self-care can help you be more generous and more supportive of other people. So it needs to become a priority. And again, they say, when's the time? But we all do things of self-care. I mean, quite honestly, even brushing your teeth can be time that you focus on you. You pay attention to what it feels like, whether it's a bath, whether it's a shower, whether it's taking a walk, whether it's driving to work, putting on your favorite music or rolling down the windows and just smelling the air. There are little things that you can do just throughout the course of the day that can help with self-care.
Okay, so I have 2 more questions for you.
Sure.
And a student said, how can a student identify test anxiety versus the typical stress that comes when taking an exam?
So a lot of what we talk about with mental health is how impairing is something. If it's impairing to the point that you're failing or you're not able to complete or you're actually having, strong physical symptoms, then I would label it, test anxiety, rather than just getting anxious, but you're still able to complete it. You're not having a suffering in grades and it's not impairing in any way. Then I would call that normal.
Okay. So when they find out, to follow up, what are common practices to reduce the test anxiety?
So first is be prepared. You'd be surprised how many people don't take the time to actually study and expect to go in based on just what they have learned in class and do well. One of the other things that I have learned over time is that they're not using their recall memory when they're studying. They're only using recognition memory. So recognition memory is when you read your notes or you read your book, okay? And it's being able to recognize the material that's down there.
Okay.
Recall memory is when you're using flashcards or quizzes and things like that, where you don't have the answer in front of you, and you have to recall that. That actually strengthens your ability to face a test, to recall that. So that when you have those short answers or those dreaded essay questions, you have the ability to recall it because you've already practiced that. One of the other things that I talk about is that using your 5 senses is really key to making a memory stronger. So I know they don't have scratch and sniff stickers as often, but they do have essential oils. So if you're using flashcards and you have one that's particularly difficult, dab a little essential oil on it. And so every time you read the question and the answer, make sure you're smelling that card. And that will actually link that in your brain stronger. I know, kind of weird, but still works. Stickers work, texture can work.
Okay.
So anything that you would do to make that card more unique than the others will bring it to your attention more. I know, easy little things that you can do like that make a big difference. It really can. Just little things like that. I've helped students go from nearly failing to B's just using little basic techniques like that.
Wow.
And then when you're facing the test, you don't have that same level of anxiety because you have more confidence in the material that you've learned. Now, other times you know the material and it's like, I still face this test and I still have test anxiety. So what I talk to students about is go through the test and find easy ones that you already know. Because in a test, there's always easier questions and then harder questions. Go through and find the easy ones to build your confidence. Get yourself more relaxed, take a deep breath, recognize, okay, I do know this, and then proceed to some of the harder questions.
Wow. That is a lot. A lot of good advice today, a lot to just have to know in such a amount of time to where I've gone my whole life without knowing some of this, and I found out just now, so I appreciate it.
Sure.
And thank you for being here. Is there anything, if you could tell somebody who's listening now, what would you say to them, in general?
Reach out. That's the main thing. We can't help if we don't know. We can't answer questions that aren't asked. Most of our faculty are well aware of the services that are on campus. There's even other students that are aware of the services and supports that are on campus. If you suffer in silence, then no, you are alone. But if you reach out, you don't have to be.
Thank you.
You're welcome.
And thank y'all.